Hello, ladies and gentlemen. I'm Haekang from Asan Medical Center. I'm very honored to present our study to Korea General Radiology as one of authors. Today, I'd like to talk about the basic principles and medical applications using three-dimensional printing. So let me start to present our study from introduction. With the help of advanced medical imaging modalities such as CT, MRI, and image post-processing technologies can be combined with a variety of tools such as multiplanar reformation, 3D visualization, and image navigation, which would be pivotal in both diagnosis and treatment. The advent of three-dimensional printing technology, sometimes called rapid prototyping, has provided a more advanced tool with an intuitive and tangible 3D fabricated model that goes beyond a simple 3D shaded visualization on a flat screen. Recently, 3D printing systems are getting cheaper because a few 3D printing mechanisms are off patent. Moreover, as 3D printable multi-materials with transparent, full-colored, and flexible characteristics are now commercially available. These developments bring about increased demand for personalized 3D printing applications. 3D printing in medicine, we primarily need a DICOM data for medical use. After patient scanning with CT or MRI, the DICOM data can be exported and processed into stereolithography data files such as stereolithography or other 3D file formats by using segmentation, surface extraction, and 3D model post-processing. In this process, we recommend you to use the image data as thin as you can get, and the image with isocubic voxel and higher SNR also enhance it for ROI to make sophisticated 3D model. No satisfactory, fully automated medical imaging segmentation algorithms have been developed. Therefore, manually or semi-automated segmentation algorithms have generally been used, such as region growing, graph cut, volume scoping, which have increased the importance of operator experience though. After segmentation, a surface model should be generated by a Martin cube or other 3D contour extraction algorithm, topological correction, decimation, repellation smoothing, or local smoothing are needed to create a 3D model for 3D printing. In addition, virtual simulation, including determination of the entry point and direction of the screw and surgical line, is performed for patient-specific surgical planning. Based on this planning, surgical guides are designed by computer-aided design software. After segmentation of a 3D model, the most suitable 3D printer for their applications needs to be chosen among various kinds of 3D printing techniques. The 3D model file is uploaded into the 3D printer. The 3D printer uses layer-by-layer stereolithographic accumulation to fabricate the 3D physical model. If you begin the medical 3D printing, you might have to prepare hardware and software system first. The 3DP hardware technology used in medicine can be classified by the technique, the material, or the aimed deposition process. Also, the materials for 3DP are classified by type of solid, liquid, powder. Today, I'd like to introduce a few typical type of 3DP machine. The solid-based 3DP technology of FDM typically uses a similar principle to SL in that it builds models on a layer-by-layer basis. The main difference is that the layers are deposited as a thermoplastic that is extruded from a fine nozzle. A commonly used material for this procedure is acrylonitrile, but a The 3D model is constructed by extruding the heated thermoplastic material onto a foam surface along a path indicated by the model data. As with SLA, support structures are required for FDM model because time is needed for the thermoplastic to harden and the layer to bond together. The supports can be removed by a simple tool or can be dissolved with a special acidic solution. Although it is the most popular 3D printer technology, the surface finish is relatively poor. The liquid-based 3D technology of polyjet printing is performed by jetting state-of-the-art photopolymer materials in ultra-thin layers of 16 nanometers onto a build tray layer by layer until the model is completed. Each photopolymer layer is cured by UV light immediately after it is jetted, producing fully cured model that can be handled and used immediately without post-curing. A gel-like support material is used that is specially designed to maintain complicated geometries and is easily removed by hand and water jetting. In fact, there is little difference between NJP and polyjet method. Polyjet printing can avail of a variety of materials, including a lava-like material, and its post-processing stage is shorter and simpler. The liquid-based 3D technology of SLA has been the most widely used 3D technique for surgery, since it was first applied for grafting a skull defect in 1994. The SLA system consists of a bath of photosensitive resin, a model building platform, and an ultraviolet laser for curing the resin. A computer-controlled meter is used to focus the UV laser onto the surface of the resin and cure the resin on a slice-by-slice basis. Generally, SLA is considered to provide the greatest accuracy and best surface finish of any rapid prototyping technology. The CJP method uses a print head to selectively disperse a binder onto powder layers. This technology has a lower cost than similar techniques. First, a thin layer of powder is spread over a tray using a roller, similar to the use in the SLA system. The print head scans the powder tray and delivers a continuous jet of a solution that binds the powder particles as it touches them. When the process is complete, the remaining surrounding powder is aspirated. In the finishing process, the prototype surface are infiltrated with the cyanoacrylate-based material to harden the structure. Because it uses CMYK color ink cartridge as used in conventional 3D printers, the 3D fabricated object can be printed with almost the same range of color. In fact, when you use 3D in the medical field, the material selection for your application is the most important. After the material has been selected, simply select it. Reasonable 3D printing. For example, if you try to print the skull for the simulator, you will need to use a material with bone-like properties. Therefore, you can use a printer in the CJP type with a plaster material. In addition, if you want to print the skin and skull at the same time, it's capable of outputting the two type different materials at the same time, use the polyjet printer. In software system, there are two kinds of program. One is program for segmentation and surface modeling. Another is mesh processing program simply. There are too many software for free or not, so you can choose by your situation. Since the early 2000s, 3DP technologies have been used in a variety of medical fields, from 3D phantom for simulation to bioprinting of organ. The former can be used in personalized treatments that take into account patient-specific anatomical variations. Personalized treatment use 3DP in surgical simulation, surgical guidance, and implantable device creation. 3DP has also been used in various scientific studies in the biomedical field. Finally, 3DP has been used for educational and training purposes. In surgical planning and operating processes for personalized treatment, 3D printed patient-specific phantoms and surgical guides have recently been used more and more, often for better understanding complex procedures and to simplify the operating procedure in the operating room. These phantoms help in diagnosis and pre-surgical planning. Recently, as transparent, full-color and flexible 3D printable materials have become available, the level of realism of the 3D phantoms for surgical planning and treatment of soft organs has significantly improved. Increased diversity due to improved transparency, color, and softness facilities, better comprehension of complex 3D anatomical structures, and guidance functions for soft tissue. Case 1 is transparent 3D printed kidney phantoms have been used to enhance pre-operative planning and intraoperative orientation of risk structures and target tissue in partial nephrectomy. All Lanner units with renal mass were modeled by in-house software, which also provides reformat the renal anatomy, renal mass, and measured each volume. The virtual resection simulation followed an adequate safety margin with 5 mm distance away from the renal mass. 3D printed kidney phantoms were fabricated by using a 3D printer. The 3D printer phantoms were used to improve surgical outcome and have the potential to improve patients' understanding of their disease and improve satisfaction as well. Case 2 is from the cardiac CT data. A septal myectomy simulation model was generated by in-house software using a 3D printer. The left ventricular myocardium, papillary muscle, and intraventricular muscle band were manufactured with differently colored materials, whose flexibility could be controlled by adding a rubber-like and transparent material. They stated that the 3DP phantom provided intuitive information on the LV geometry, including the extent of the hypertrophied septum, the location and length of the papillary muscle and intraventricular muscle band, which are allowing preoperative simulation of the surgical myectomy. Customized implants created using 3DP have recently been used in the interventional field. Case 1 demonstrated the feasibility of a personalized interventional treatment for tricuspid regurgitation using a braided stent in an animal study. From the cardiac CT data, the 3D reconstructed model of the right-sided cardiac cavities of a pig was obtained. A solid aluminide mold was manufactured using a 3DP system, and then a personalized compressible nitinol stent was subsequently produced and fitted onto the 3DP mold. This customized stent was almost completely fitted onto the right atrium, and an additional tubular stent component containing tissue valve prosthesis was developed. From the feasibility study conducted in animals, they found that the 3DP-based stent could stabilize the biological valve prosthesis by force transmission from the annulus to the arterial wall and the adjacent vena cava. Another example of the 3DP-based medical implantable application is the use of medical-grade silicone material for soft tissue. Case 2 shows a pilot study to develop a patient-specific soft implant for filling a dead joint of lung after pulmonectomy. From the CT data, the volume of the dead joint was three-dimensionally reconstructed. In this pilot study, a 3D printer system was used to manufacture the patient-specific phantom of the dead joint, which was used as a mold to make a negative mold with silicone material. The final dead joint phantom with silicone material was cast by using the negative mold, and the softness of the 3D printed material was evaluated by clinicians. In the near future, the final implantable device could be manufactured with a medical-grade silicone material through an additional molding process and evaluated in the prospective clinical trial. For better understanding of complex pathologies, a variety of in vitro and ex vivo studies have investigated phantoms fabricated by 3D printing. These tangible 3D printing phantoms by themselves provide much more intuitive information than more 3D visualizations. Furthermore, various in vitro studies have been more beneficial, such as for assessing the hemodynamics or aerodynamics of cardiovascular or airway disease, because abnormal interactions between fluids and organs in a disease model can be delicately investigated through patient-specific fluid phantom studies. The detailed fluid dynamics information, including that of disease models, provided by these experimental studies may also facilitate post-operative simulation for clinicians. A 3D compliant model mimicking the elastic properties of vessels has also been manufactured with silicone or polyurethane material. Recently, a descending aortic dissection phantom fabricated by 3D printing has used a two-mode process to mimic the intimal flapping motion of aortic dissection. From the CT data, they generated a 3D reconstructed model of descending aortic dissection that was modified to manufacture a 3D printing mold for silicone casting. A 0.5 mm layer was first cast on the true lumen mold, and the second casting was then performed over the initial cast to make the first lumen. 4-dimensional flow MRI was used to quantitatively measure the local velocity profiles of both lumens. In case 2, a fluid dynamic study of paramedian pontine infarction caused by atheroma, obliteration of the perforation of the basilar artery was performed. Using the MRI data, a stenotic A basilar artery model was generated by dedicated software and was then 3D printed model ABS thermoplastic material by a 3DP system. A 3DP basilar artery phantom was cast with a polydimethylsiloxane silicon compound, and then the ABS material was dissolved out from the PDMS in acetone. The fabricated PDMS phantom with hollow basilar artery morphology was applied to a fluid dynamic experiment using particle image velocimetry, which is a quantitative velocity field measurement technique that uses optical scanning. This experimental study verified the hypothesis that perforator infarction can be caused by hemodynamic mechanism that is triggered by stenosis-induced recirculation flow at the post-stenotic area. Patient-specific 3D models fabricated by the 3DP system have been used to train young surgeons in surgical procedures. The recently developed multi-material 3DP technology provides more realistic phantoms that mimic real hard and soft tissues. Case 1 used multi-material neurosurgical phantoms with a pathological entity with varying consistencies and densities for their trainees. From the CT data, they used in-house software to generate a 3D reconstructed model of the skin, bone, dura, and tumor, and manufacture 3D phantoms by using a 3D printer. They stated that their trainees practiced the basic steps from navigation and planning of skin flaps to the initial steps in a craniotomy and simple tumor excision. Similarly, Case 2 is a 3DP phantom for training the transcatheter aortic heart valve implantation procedure. From the cardiac CT data, left ventricular width calcified bicuspid aortic value and aorta covering the catheterization route was 3D reconstructed by dedicated software. Using a 3D printing phantom with multi-material was manufactured, in which the soft tissue of the aorta and leaflet was made of flexible material, and the calcification was expressed with hard material for better representation of the real situation. Catheterization intervention using a TAVI was simulated using a fabricated 3DP phantom. In addition, a 3DP phantom with multi-material could provide trainees or surgeons with various educational and rehearsal simulator based on both patient-specific and disease-specific anatomy. By training and rehearsing with these simulating phantoms, trainees and surgeons may gain more confidence before performing real operations. With the development of inexpensive 3D printers, 3D printable multi-materials, and 3D medical imaging modalities, 3DP medical applications have come into the spotlight again. Due to the availability of transparent, full-colored, and flexible multi-materials, 3DP projects can be more realistic, mimicking the properties of the real body, not only hard tissue alone, but also hard and soft tissue together. Even though there has been a substantial increase in the number of 3DP medical applications, there are still some major limitations, such as those associated with the technology and the time and cost of manufacturing 3D phantoms. Development and optimization of the entire procedure, from image acquisition to 3D fabrication, are required for personalized treatment, even in emergency situations. In addition, it is important to select a specific medical situation with a clear clinical implication so that The additional costs of 3DP are outweighed by the improved rate of success and shortened operative time. Furthermore, to get a proper 3DP object in our hands, multidisciplinary knowledge is needed of the entire 3DP process chain, namely, image acquisition with a protocol suitable for 3D modeling, post-processing of the medical images to generate a 3D reconstructed model, 3D manufacturing with a proper 3D technique, and post-processing of the 3D object to adapt it to its medical use. In the study, we presented the practical medical applications of 3DP that are based on currently available 3DP technologies. It is hoped that this article will help its reader to understand the various 3DP medical applications and find a way to incorporate them into their clinical practice. Thank you for your attention.